Welcome back to Healthy Living for Life. We're joined now by Deshane Barnett, the Executive Director at Missoula Urban Indian Health Center. Thanks for being here, Deshane.
Yeah, thank you for having me.
What are urban health centers?
Yeah, so the Indian Health Service system is divided into 3 tiers. So there are clinics and hospitals that are operated directly by the federal government. There are clinics and hospitals that are operated by tribes, and then there are 41 urban Indian health centers throughout the United States. We're standalone nonprofit organizations that receive funding from the Indian Health Service to provide services in urban areas where American Indians reside.
So what do the statistics look like comparing urban folks that are living in an urban area and the more rural?
So one thing is that there are more American Indians living off of the reservation than living on. So about 78% are off the reservation, 71% are living in urban areas, metropolitan areas. So, roughly 7 out of 10 American Indians live in a metropolitan area. So if they're going to get services, they either have to travel, sometimes a long distance back to a reservation, or they can come to an urban Indian health center, if they're lucky enough to have one in the town that they live in. And so we provide a lot of services, and I don't know if this is also where you were going, but health-wise, statistics, people are surprised to hear that urban Indians actually tend to have higher rates of chronic disease, higher rates of poverty, higher rates of unemployment than even on the reservation a lot of times. So we're dealing with all of those issues, but we're doing it in a setting in a larger city instead of out on the reservation.
So there's a lot of challenges that you're facing. Well, how do you overcome those challenges?
Piece by piece.
Long sigh there, right?
Yeah. So our centers really have to be comprehensive and be the hub for the community, because we have to be addressing all of the social determinants of health. So we're obviously trying to provide direct medical care, but we're also providing mental health services, substance abuse services, we provide dental services, and then we also have to try to provide services that support education, employment, housing. We can't, if someone comes into our clinic, we can't give them a shot to make them better and then send them out into a situation that's unhealthy. That's just not the way it works. They're not going to get better. So we have to work on making their entire environment healthy, and it's a challenge.
So you're with the Missoula Urban Indian Health Centers.
Yes.
So what services do you provide? You've touched on that.
Yes, so we actually were lucky enough that in September of 2018, we just got our first full-time medical provider. So we provide full-time primary medical care services. We do provide some very limited dental services. We're hoping to ramp that up later this year. And then we provide a lot of mental health, substance abuse services, and then also community health services. So we do a lot of things like diabetes prevention, diabetes self-management, traditional foods, healthy foods, sustainable living, things like that.
How many staff, out of curiosity, at this
Right now we're at 21.
Okay.
Yeah.
So do the urban Indian health centers look the same across the nation, or is there anything unique about the one in Missoula?
Well, yeah, so we are actually one of the smaller ones. We're sort of a fledgling, but even at that, the saying is that if you've seen one urban Indian health center, you've seen one urban Indian health center. They can vary greatly in budget, staff, services, location, patient mix. Some might, be located in an area that has maybe a lot of representation from 1 or 2 tribes. Others are in places, for example, our clinic, we see people from over 50 different tribes. So it just really depends. No 2 centers look exactly alike.
So earlier we learned about Indian Health Service and tribal health service programs. What are the differences between those and an urban Indian health center?
Well, the biggest difference for me is that urban Indian health centers are 1% of the total IHS budget. So, like I mentioned before, 7 out of 10 American Indians live off the reservation. We're trying to meet those needs on an extremely limited budget. So 1% of the total IHS funding goes for urban Indian health programs, which means we, in current day lingo, we have to hustle. I have to, every dollar that I get from IHS, I have to leverage for several other dollars from somewhere else. Otherwise, I'm not going to be able to meet the needs of the community.
So what about the three of you different entities? Do you all work well together, play in that sandbox well?
Yeah, actually, one of the great things here in Montana, we have the American Indian Health Leaders, whereas that's all of the tribal health directors from every single tribal health program and all of the urban Indian health leaders and the IHS all at the same table. Not only do we meet in person quarterly, we talk to each other on the phone every week, once a week. I mean, we really do work to support each other as best as we can, because eventually we are serving the same population. I'm serving their aunties and uncles. Sometimes we're serving the same folks. They live on the reservation for a year, they come down to Missoula for a year. They're going to school here, they're here for 3 or 4 years, they go back to the reservation. So our populations are not separate, it's the same population. So we work together, I feel like we work together really well.
Wow. Well, we've got a little less than a minute left. So can you talk about what you've seen change over the years, the population you're serving?
Yeah, so what's happening is that with the younger population, they are in a really weird place where they absolutely do inherit the trauma, but they don't have as much access to the cultural traditions that we had in place to support healing. And so that's one of the things that the urban centers like myself really have to try to bring back to them. Whether they know it or not, they are carrying the trauma of their parents, their grandparents, even their great-grandparents, but they don't necessarily have access to those traditional healing services. So we bring those to them, and hopefully we can see a shift in that.
Oh, thank you so much, Deshane.
Yeah, well, thank you for having me.
Thank you to our special guests and to you, our viewers. We'll see you next week. In the meantime, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.